We are sharing some news that, our baby girl, Stella, has a rare heart defect. It's called Tetralogy of Fallot with Pulmonary Atresia. So what does that mean? We turn to pediatric cardiologist Dr. Alan Singh to talk more about what Tetralogy of Fallot is and the treatment for it. You're a pediatric cardiologist at the same practice where our cardiologist also works. So first of all, what is a simple way of explaining Tetralogy of Fallot?
Yeah, so Tetralogy of Fallot is a heart condition that somebody is born with. And it gets its name from a French doctor named Dr. Fallot, who first described this in the mid-1800s. And the best way to think about this is that the heart has 4 chambers in it, and the bottom 2 chambers are called the ventricles. And in between those 2 ventricles, there's a wall called the ventricular septum. And in between those 2 ventricles, there's not normally a hole in that wall. But what happens is that in Tetralogy of Fallot, at the upper part of that wall, it becomes separated from the bottom part. And that wall begins to rotate into the right ventricle. Now that can leave a defect or a ventricular septal defect in that wall. But then as it rotates, it can begin to block blood as it exits the right ventricle and goes into the lungs. Now, if there's just a little bit of rotation, there may not be that much obstruction. But if there's a very severe amount of obstruction, that can cause really low oxygen levels. And in the most severe form of it, you can have complete obstruction, and we would call that pulmonary atresia. Now, you may remember a couple of years ago, Jimmy Kimmel mentioned that his son had Tetralogy of Fallot.
I have watched his monologue many times.
Yes, and so I think that raised a lot of awareness for this too.
Right, and back in the day, they would call this, the blue babies who were born low on oxygen, like you mentioned, and needed that kind of treatment. There has been so much advancement in caring for babies and even, diagnosing this for us at 20 weeks at our anatomy scan. What is the treatment plan typically? I know it's going to be different for everyone that you guys see.
Yeah, so ultimately all patients with Tetralogy of Fallot will need a surgical correction. Now, if there's just a mild amount of obstruction and the oxygen levels are acceptable, the typical aim is around 3 to 6 months of age for a full surgical repair. However, if there's very severe obstruction and their oxygen levels are dangerously low at birth, a lot of times these patients will require a temporary procedure within their first week of life to stabilize their oxygen so that they can get to an age and a size where they can do the full repair later on. Now, it is an open heart procedure. The surgeons have to go into the heart and put a patch where that hole is, and they also have to relieve the obstruction as it goes into the right ventricle. And many times, these patients will need another surgical procedure in their teenage years to replace a specific heart valve, but in general, their outcome is really good.
Well, and I know we were relieved to learn with the pulmonary atresia that she'll be able to have a catheter procedure initially to put a stent in, which is much less invasive, easier recovery. So there are so many things in the medical world that are making this easier on families. I think one of my husband and I, one of our biggest concerns, what does this mean for long term? I mean, is she going to grow up, not able to play sports, not able to be an active, normal child running around playing? And one of the first things doctors told us is they said, oh, the Olympic snowboarder Shaun White, he has Tetralogy of Fallot, and look at him. And that was so helpful to follow his journey and to see, wow, not only is he an excellent athlete, he's in one of the most extreme sports you can think of as a snowboarder. So what do you tell parents when I'm sure that's a concern for so many going through this.
Yeah, and in general, the outcomes are excellent. We have an amazing team at Children's Health where we can help take care of them from the very beginning, even before they're born, with our fetal heart program. Our surgeons have excellent surgical outcomes, and we can take care of them even through adulthood. And they will need that other surgical procedure oftentimes in their teenage years. And there may be a slightly higher rate of heart rhythm issues as they get older, but as long as a patient follows up with their cardiologist on a regular basis, we really expect their outcomes to be excellent. We don't typically restrict them from sports or physical activity, and in fact, we encourage exercise as part of a heart-healthy lifestyle.
All right. That is great news for us to hear. We appreciate you coming in and talking to us and sort of breaking this all down. I know that, earlier when we shared about the diagnosis on Good Day, I was like, I'm not going to get too in the weeds on what Tetralogy of Fallot is, but I'm glad we had you here to explain it much better than I could do. So,
thanks for having me.
Thank you so much. And of course, when there are updates to share, I'll do so on social media. You can follow along there. And in the next hour, we're going to speak with our nurse practitioner about how Children's Health really supports pediatric heart patients and their families. She has done so much for us.